Hi everyone, this is Harshita. Welcome to TeddyGetYou channel. So today in this video we are going to discuss an important topic, that is nephritic syndrome. Nephritic syndrome. In systemic renal diseases, we come across two important topics. First one is nephritic syndrome and the second one is nephrotic syndrome. The difference between these two syndromes are very important, and in that first let's discuss about the nephritic syndrome. Okay. So before knowing anything, it's very important to know what are the clinical presentations. So clinical features for nephritic syndrome. First one is proteinuria. This proteinuria is common for both nephritic syndrome and nephrotic syndromes, but the value of the proteins in the urine is very different. For example, in nephritic syndrome, we will have less than 3.5 grams for 24 hours. So in nephrotic syndrome, you will observe greater than 3.5. So greater than 3.5 milligrams for 24 hours of proteins are seen in the urine. Okay. And the second one is azotemia. Azotemia is nothing but the ammonia in the blood. Ammonia in blood. Robin says that azotemia is a biochemical abnormality. Biochemical abnormality, and in this abnormality you will see bun. So bun means, you already know, right? Blood, urea and nitrogen, and also creatinine will also increases, but in some conditions there will be decrease in the glomerular filtration rate. And azotemia is not only confined to the renal diseases, but it also confined to some other diseases like pre-renal azotemia. Means you can see it in hemorrhages, shock and volume deletion. So these are the conditions in which you can see azotemia. And the third one is edema. Edema is also present in the nephritic syndrome. And the most important features that you must remember is fourth one, hematuria, means cola colored urine, and the last one is hypertension. So these are the important things that you should remember. First one is hematuria is very important. Make sure that you remember this. And hypertension, hematuria and hypertension and azotemia. So these are the very important clinical features for nephritic syndrome. And nephritic syndrome divided into two types. First one is post-streptococcal glomerulonephritis, and the second one is rapidly proliferative glomerulonephritis. Okay. So now let's discuss them about these two diseases. First one is post-streptococcal glomerulonephritis. Post-streptococcal glomerulonephritis. So the common age is 5 to 15 years. The people having 5 to 15 years are more prone to post-streptococcal glomerulonephritis. Next one is, it is type 3 hypersensitivity reaction. Okay. So immune complex mediated. And the most important is, it occurs 2 to 3 weeks after getting infected by beta hemolytic streptococci. Okay, so this is very important. This beta hemolytic streptococci is also cause another disease which is related to the heart. Can you guess it? Please let me know in the comment section that what is the disease. So you may be wondered, right, how can same organism cause two different types of diseases? Because the strains are different. In these, the strains are 1, 4 and 12. So these are the important strains that you must remember. Okay, let me change the color. So these are the important strains that you must remember. Okay, and the most important point that you must remember is the patient will surely present with the cola colored urine. Okay, so with this you can diagnose him that he is having post-streptococcal glomerulonephritis. If he have a sore throat 2 to 3 weeks after any kind of infection, and he may be between 5 to 15 years, you can keep this as your differential diagnosis. Now, let's go deep into the topic. What are the abnormalities that you can see in the light microscopy, electron microscopy and immunofluorescence? Now first let's discuss about the light microscopy. So what are the things that you can observe in the light microscopy? This is the diagram that is showing post-streptococcal glomerulonephritis. Okay, this is the normal glomeruli. This is the abnormal one. Now let's find the differences. Comparing to both the images, this is hypercellular. So in light microscopy, you can observe hypercellularity of the glomeruli. There will be rapid proliferation because of which you can observe hypercellularity. And these hypercellularity, let me write it here. Enlarged and hypercellular glomeruli. Okay, and there are many reasons for this hypercellularity. In that, the most important are 3 reasons. First one is infiltration by leukocytes. Infiltration by leukocytes. These leukocytes may be of neutrophil or monocytes. This is the first reason. Second reason is proliferation of the endothelium and mesangial cells. Proliferation of endothelium and mesangial cells. And the third one is severe cases by crescent formation. These are the reasons for enlarged hypercellular glomeruli which we can observe in the next one is electron microscopy. Next one is electron microscopy. So in electron microscopy, you can easily see subepithelial humps. So for example, if you see here, you will observe accumulation of the immune complexes in the epithelium. So you will see subepithelial humps. So these are the features that you can observe in the electron microscopy of post-streptococcal glomerulonephritis. Okay. Now let's move into the immunofluorescence, which is very, very important. In this image, you can easily observe granular deposits. So these are nothing but coarsely granular deposits. What are these deposits? These deposits are nothing but the complement protein C3. Complement protein. These are the findings that you will find in the electron microscopy, light microscopy and immunofluorescence. Okay. And you must also remember that these looks as the starry sky appearance or starry sky pattern. Okay. In pathology, this starry sky is observed in 2 cases. First one is Burkitt lymphoma and the second one is acute proliferative glomerulonephritis immunofluorescence. So these are the things that you must remember. And the last one is treatment. Self-limiting. I hope you are clear up to now. The second type is rapidly progressive glomerulonephritis. So this is also very important. This is a medically emergency conditions. Medically emergency condition. It is also called as crescentic glomerulonephritis, which implies 50% of the glomerulus in biopsy shows crescents. So for example, if you see glomerulus will be covered by some of the half moon shaped crescents. Hence it is also called as crescent glomerulonephritis. Okay. And this rapidly progressive glomerulonephritis is divided into three types. First one is anti-glomerular basement membrane associated. Type 2 is immune complex or antibody mediated. Immune complex or antibody mediated. Rapidly proliferative glomerulonephritis or no antibodies or immune complexes you can find here. Okay. So there are some diseases that are associated with these types. In type 1, you can observe Goodpasture syndrome. In type 2, you can see SLE, and here post-streptococcal glomerulonephritis can be converted into the rapidly progressive glomerulonephritis. And in the third one, you can see some of the diseases that are associated with the blood vessels like microscopic polyangiitis, which is associated with the perinuclear anti-nuclear cytoplasmic antibodies. And the second one is venous granulomatosis. Granulomatosis. This is associated by the C ANCA. So these are the points that you must remember. Now if you see the microscopy, first one is light microscopy. I already explained you that 50% of the glomerulus are crescentic glomerulonephritis. So 50% are, let me change the color, glomeruli are crescentic glomerulonephritis. So the main point that you must remember is, what are these crescents? According to the Robbins, or these crescents are nothing but the proliferation of parietal cells, and the second one is migration of monocytes and macrophages into the urinary spaces. And you may also see neutrophils and lymphocytes in these places. So because of these three reasons, you can observe the concentric glomerulonephritis in the rapidly progressive glomerulonephritis. Okay. And the next one is immunofluorescence. Second one is immunofluorescence. So this immunofluorescence is different for every type. For example, in type 1, you can observe linear pattern. Means there will be no accumulation of any immune complexes. In the type 2, you can observe granular pattern. In type 2 you can observe granular pattern, and in the type 3 you can observe no deposits. So these are the findings of the immunofluorescence. And the last one is electron microscopy. In electron microscopy, you can easily observe rupturing or wrinkling of the basement membrane. Rupturing or wrinkling of basement membrane. So these are the findings that you can observe in the light microscopy, immunofluorescence and the electron microscopy. Let me revise them again. So in the light microscopy, you can observe crescentic glomerulonephritis. And these crescents are because of proliferation of the parietal cells or migration of the monocytes and macrophages into the urinary spaces, or maybe because of the neutrophils and lymphocytes. Immunofluorescence may be linear, granular, and you may also observe no deposits in the immunofluorescence. And the last one is electron microscopy. In electron microscopy, you can observe rupturing and wrinkling of the basement membrane. Okay, so these are the important points that one should remember in the rapidly progressive glomerulonephritis. So let's move deep into the topic. Okay, that is Goodpasture's syndrome. Understanding this Goodpasture's syndrome is very, very important. So this can be remembered with the mnemonic called as 1, 2, 3, 4. I already discussed with you that this is type 1 of rapidly progressive glomerulonephritis, and it is type 2 hypersensitivity reactions. And the third one is alpha 3 chain getting affected, because of which we can see type 4 collagens. Okay, because of the defect in the alpha 3 chain, you can observe type 4 collagen. Okay, so this is the pathogenesis. And the next one is light microscopy. What are the features that you can see in the light microscopy? As always, in light microscopy, you can see crescents. Let me change the color. You can observe crescents. And in electron microscopy, you can observe break in the glomerular membrane. And in the immunofluorescence, you have only two options. First, either it is granular or it is linear. Here you can see linear pattern. So these are the investigations you must do. In Goodpasture's syndrome, you observe alpha 3 chain is getting affected, whereas in thin basement membrane disease, you can observe, here you can observe alpha 4 chain is getting affected, because of which type 4 collagen gets deposited here. So this is all for today. If you not yet subscribed to the channel, please consider subscribing to the channel to guide you. This is K. Harshita signing off. Thank you so much.